Hello, this FERNE presentation deals with the treatment of ED patients with dizziness and vertigo with an attempt to successfully diagnose and treat serious central etiologies. My name is Edward Sloan. I'm an emergency physician in Chicago. I have served as the FERNE president and board chair for over 3 decades. I have no financial conflicts. I encourage you to go to our FERNE.org website or YouTube channel for more information and content related to the optimal care of patients with dizziness and vertigo. And I would encourage you to follow us on social media for more real-time information on the care of all patients with neurological illnesses, injuries, and emergencies. FERNE.org. So we're going to talk about the 3 vertigo types and the related diagnoses to these 3 vertigo types. In doing so, you can be more clear in your diagnosis of vertigo. So this table focuses on vertigo timing, triggers, and whether or not the symptoms are current. This comes from a monograph published with EB Medicine in 2019 by Dr. Jonathan Edlow. This is a great monograph. So from this table, you can see there's vertigo timing, triggers, and diagnoses. There are 6 benign and 4 serious causes, and we'll talk about one more. So in green, we have our 3 types of vertigo, and as you go across each row, in yellow are benign causes, and in red, more serious and rare causes. So let's just talk about the benign and serious causes. AVS, acute vestibular syndrome, is seen in a patient who presents with ongoing continuous dizziness. Benign causes include vestibular neuritis or labyrinthitis, but more serious causes can include posterior circulation ischemic stroke. In the second row is spontaneous episodic vestibular syndrome, episodic dizziness that comes on spontaneously. It can be caused benignly by vestibular migraine or Meniere's disease, but a more serious cause includes posterior circulation TIA. And last is triggered episodic vestibular syndrome, which is episodic dizziness usually triggered by a change in head position or standing up. This can be caused benignly by BPPV or orthostatic hypotension, but more serious causes can include central positional vertigo, or orthostatic hypotension related to a serious medical condition such as hypotension and bradycardia. Also, this triggered episodic vestibular syndrome can, in rare cases, be caused by a posterior fossa tumor. So in reviewing these 3 vertigo types and the diagnoses related to them, both benign and serious, you understand that by looking at vertigo in terms of its triggers and timing, you can come up with 3 specific diagnoses and then relate common benign and serious diagnoses related to those. If you have comments or questions, please go to fern.org@gmail.com. And I want to thank you for your time. Have a good day.